IWM.
Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. Last week we saw a strike in some parts of India by unions of ASHA workers who are accredited social health activists. These women are really the backbone of India's public health workforce in a lot of ways. If any of you have read our document on how India could tackle a second wave, you may have noticed that we talked a little bit about how ASHA workers were integral to activities such as contact tracing. And what we're going to do over the course of this podcast really is understand what ASHA workers really do. Why are they so important to India's public health system? What have they been doing through the course of this pandemic, and why have things reached such a grim situation that they had to go on strike in the middle of a pandemic? Finally, we'll conclude by talking a little bit about what kind of policy interventions might help to make their lives easier. I'd like to welcome Sunila. Hey, Sunila.
Hi, Anirudh.
So, as all of our listeners might know, Sunila writes quite extensively about public health. So, over the course of the next half hour or so, Sunila and I are going to be talking about ASHA workers. But let's first try to understand who exactly ASHA workers are. Sunila, can you tell us how ASHA workers got started? What kind of role do they play in India's public health systems?
Yes. Firstly, so many people may not know, but ASHA actually stands for Accredited Social Health Activists. So that kind of sums up their role. ASHAs are basically the first point of contact between the population and the public health system of India. Now the cadre of ASHAs is actually not that old. They were introduced in the year 2005. In the early 2000s, the government of India was in the final stages of developing the National Rural Health Mission, which was launched in 2005 to improve the public health system of India. So the initial draft proposal for the National Rural Health Mission included a provision for a national community health worker cadre, which focused only on mobilizing family planning and promoting institutional delivery. But the civil society actors argued that such a narrowly defined role for community health workers would be a lost opportunity. And hence the Ministry of Health and Family Welfare responded by creating a stakeholder task force to design the ASHA program. So this task force, together with the ministry, developed the ASHA guidelines that became central to defining the program's scope. So when they were designing the ASHA program, the task force drew lessons not only from the earlier relatively unsuccessful state-run community health worker programs, but also from several successful civil society-run programs. So the thing is, women volunteers for health, they have always existed in India, but they were not recognized as ASHAs before 2005. But under the National Rural Health Mission, they were officially introduced as ASHAs, who could assist the auxiliary nurse midwives in running the community outreach health services. So this is how the cadre of ASHAs came to be in the public health system of India.
And what exactly do ASHAs do? I mean, from your explanation, I would guess that they do a lot of direct work with people in rural areas. So do they work on, do they actually provide healthcare services? So do ASHAs go out and actually administer prescriptions and medication? Or are they more of a auxiliary force acting as, for example, midwives in kind of communicating government health initiatives? What exactly do they do?
So ASHAs do a range of activities on the ground level. So their areas of work actually involve maternal and child health, reproductive and sexual health, family planning, control of infectious diseases and non-communicable diseases as well, sanitation, and they also assist Anganwadi workers in implementing nutrition schemes as well. So under maternal health, they assist the pregnant women through the course of entire pregnancy by registering them in a public or private hospital depending on the accessibility of the facility. Then they ensure that the pregnant women go for antenatal checkup at least 4 times during the course of pregnancy. And post-pregnancy, they ensure breastfeeding for the child. So they ensure the pregnant women are well aware of how breastfeeding has to be started within an hour of delivery. So that's for maternal health. And for children's health, they arrange immunization as well. For family planning, they counsel families on contraception. They distribute contraceptives as well, and they counsel adolescents on reproductive and sexual health. For infectious diseases, they inform the primary health centers and sub-centers about the disease outbreaks. In case of tuberculosis patients, they provide the DOTS treatment, and they are trained to treat minor illnesses such as diarrhea, fever. Otherwise, they are involved in lot of awareness generation work, because they are the first point of contact between population and the health system. They have the ability to convince people to seek healthy behavior. So they are involved in lot of information, education, and communication activities as well. They are also involved in collection of vital statistics such as births, deaths, marriages, and they communicate these vital statistics to Panchayati Raj institutions. So, whole lot of activities that they do on ground.
So that is insane. I mean, this is an array of tasks ranging from communication to record keeping to deployment of medicines. I mean, it's actually pretty insane. It looks like it would require a massive amount of commitment in terms of time, in terms of skill, and it's also quite deeply connected, I can imagine, to a lot of very important indicators of India's public health, such as infant mortality or maternal mortality rate. So overall, they do seem like a very, very important aspect of our public health workforce, which of course I think brings us to the question of what exactly ASHA workers have been doing through the course of the pandemic. So I've been reading a few news articles, Sunila, and the impression I've gotten is that ASHA workers have continued to be extremely important throughout this pandemic as well. They seem to be continuing more or less the same kind of duties, right? So communication, collecting data, actually going out and getting people to get tested, getting people to actually go to hospitals. And I can imagine that they've really saved a lot of lives over the course of this pandemic. But increasingly, we're seeing that ASHA workers are kind of pushing back, and as I mentioned at the beginning of this podcast, are now going on strike, because even though they're playing such an important role in India's public health during this pandemic, perhaps partially because of the fact that they are kind of out of the spotlight of the national media as compared to, say, doctors and nurses in hospitals, ASHA workers are not getting anywhere near the kind of important incentives that they are going to need to actually do their jobs effectively. So can you take us through that as well?
Yes, I agree with what you said just right now, because before answering this question of yours, let me begin with that ASHAs have been instrumental in improving the health indicators of India. Like, they have increased the number of institutional deliveries that are happening in India, which is directly responsible for reducing the maternal and child deaths. And overall, they have been really successful in getting people to adopt family planning methods or in general healthy behavior. So you cannot emphasize enough the importance of ASHAs in public health system of India. Now, before I get to what they have been doing for the management of pandemic, I want to bring to attention that according to National Health Mission rules, ASHAs are considered as honorary volunteers. So they are not considered as workers under minimum wage law. In a sense, they do not receive any salary or honorarium. Their earnings are only incentive based according to the National Health Mission rules. So when I say incentive based,
That's
it means
ridiculous.
Yeah, I know. So when I say incentive based, it means that so there are a number of national health programs for control of tuberculosis, vector-borne diseases, and so on. So how they receive incentives is that when they achieve a certain parameter, then they receive an incentive for that. So for example, if an ASHA is successful in getting a pregnant woman deliver her child in a public health institution, then she gets an incentive of say rupees 250 for that. That if she is successful in getting a family to adopt a family planning method such as IUCD insertion, then she gets an incentive of another 200 rupees. So it is incentive based. But some of the states in India, they do offer fixed monthly salaries anywhere in the range between 3,000 to 5,000 rupees, along with the incentives that come with the National Health Program. Now, 3,000 to 5,000, it's like peanuts, but then it is like at least they are giving a fixed salary. So this is how the situation of ASHAs is. Now, for COVID-19, as you mentioned already, they have been involved in a lot of COVID-19 duties, which includes identifying the migrating population, screening of suspect persons for COVID-19, contact tracing, and patrolling of containment zones. And the ASHAs are doing all of this along with their regular activities, which I mentioned before, are related to maternal and child health, family planning, communicable diseases, etc. This is the background, I guess, which we need to understand why the ASHAs went on strike in the month of August. So their complaints were, of course, anyway, they are overburdened with all of the range of health activities they are doing. And to add to that, they now have to do COVID-19 duties as well. So obviously their workload has increased discriminately. And to top it, whenever they go for contact tracing or screening of patients, they face discrimination or resistance from the community. I have read reports saying that some of the people just shut the doors on their faces because they do not want to share their details, or they do not want to get themselves admitted to COVID care centers. So they are facing humiliation as well. And then the government of India, they had declared an incentive of rupees 1,000 per month for COVID-19 duties for ASHA, but the amount hasn't reached them yet. Also, many of the ASHAs, they haven't received personal protective equipment such as N95 masks or gloves, and not even sanitizers. And the main thing to note is that these ASHAs, they come from poor households. So the husbands of most of the ASHAs, they are like daily wage workers. But with the lockdown, the husbands lost their job, and ASHAs were like the only source of income. But when ASHAs themselves started catching the COVID-19 infection, even they lost their source of income. So it has been really bad for them with the COVID-19 duties still.
This is such a it's a really messed up situation, and there's just so many layers to it, right? I mean, I did this podcast with Soumya Kapoor, who heads the initiative for what works for women and girls in the economy, and which we'll probably link to in the description. And she had some really interesting points to make on how COVID-19 has impacted gender and labor dynamics, especially in rural areas, right? Because you have massive unemployment now. In a lot of cases, men have lost jobs in cities; they've had to come back, and that dynamic, which has kind of changed how families work, which has kind of changed the kind of workload that women have to carry. In addition to the fact that now they have even more of a workload as ASHA workers, that they're involved in all these other activities with minimal government support, with an incentive-based system, which is, I mean, the basic point of an incentive-based system is to make people want to do more work, right? But
Right.
even if people are willing to do work, if you don't create the situation where they can do that work and where they can receive the incentives, it seems ultimately counterproductive. And I mean, it seems to me that the government is really kind of trying to shoulder off the responsibility of fighting the pandemic onto ASHA workers, because they know that they are not a very loud and powerful constituency. There are so many simple things that could really make their lives a lot easier. The first thing, of course, would be to simply pay them more, have a fixed salary for them through the duration of this pandemic, and arguably, given the important work that these women do, give them a permanent fixed salary, given the kind of of tasks that they have to perform, given the fact that many of them are also mothers and have to run a household as well. And especially given the fact that we've talked about this in other podcasts as well, if you're going to put money into a woman's bank account, whether she's a mother, whether she's a working woman, she is going to go out and spend that money and ultimately help increase consumption, purchase goods and services, and it's ultimately going to improve both India's public health situation and India's economic situation if ASHA workers were simply to get their due. But there's also other things, right? I would think that one really big, really easy thing that could be done is proper communication, which I really don't think the Indian government is doing very effectively. And there are, of course, a lot of reasons for that. But stuff like people who are going out to do contact tracing, people who are actively going to go out and try to save people's lives by sending them to hospitals, having their doors slammed on their faces kind of shows you the amount of paranoia that exists among Indians regarding the coronavirus. And all of these can be addressed through concerted action by the government. It doesn't seem like any of these are particularly difficult things for the government to do, right? And it's kind of sad that ASHA workers have to go on strike to ask for these basic demands. But to me, it seems like a perfectly fair and reasonable outcome given the way that they've been treated so far. What are your thoughts, Sunila?
Definitely, I agree with you. I think the first thing to do would be legalize the status of ASHAs that ensures minimum wages for them. Because even before COVID-19, I believe that they were already overburdened with all of the activities that they were doing. Adding COVID-19 duties to that, and you're giving just ₹1,000 as an incentive for those duties per month, and which are not even releasing it on time. So I think it's only fair enough that ASHAs went on strike. And the worst part is that there is no data on how many ASHAs, official data on how many ASHAs are infected or have died due to COVID-19 infection. So I think that's the basic data that the government needs to have to actually, address the needs of ASHAs in times of COVID-19. In Maharashtra itself, according to estimates, there are around 320 ASHAs that have been infected with COVID-19. And to add to that, there's disparity between urban and rural pay as well. So rural ASHAs get paid much lesser than urban ASHAs too. And in Maharashtra, there was this case where, the ASHAs, when the ASHAs asked for proper protective equipment, they were just given 8 cotton masks and 1 liter bottle of sanitizer, which was not replenished since last 6 months. So ASHAs had to shell out their own money to buy for the required masks or sanitizers. So you are expecting a lot from ASHAs without giving them any financial incentives to look forward to. Incentives of ₹1,000 per month. I don't know how to put it in this. It's zilch. ₹1,000 is nothing for doing COVID-19 duties when you're risking your life.
Yeah, exactly. ₹1,000 to run a household, and those ₹1,000, as you said, that's not even guaranteed. It might come late. And that these women are still going out there and still exposing themselves, putting themselves on the front line of fighting this. It takes a lot of bravery, and I really don't understand what motivates them to sacrifice so much. And more importantly, what's keeping the government from actually doing something for them, in the early stages of pandemic, you had all this hangama about COVID warriors and petals being dropped on hospitals and so on. But these are also frontline workers. These people are also doing some really, really important work in fighting the pandemic. And the least that I think society can do, and more importantly, the state can do, is not to make their lives any more difficult than it already is.
Yes, true.
All right, cool. Thank you so much for joining me, Sunila. This has been an interesting conversation. As I mentioned earlier, we will have a link to my podcast with Soumya Kapoor of IWWAGE on how women have been affected by the pandemic in the description for this podcast. And thank you so much for joining us today on All Things Policy.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. Speaking of Instagram, Niharika Pandey joined Cyrus this week on Cyrus Says. Niharika is the strategic partner manager for Instagram India. Great conversation about the plans for Instagram in India. Karanjit Kaur joined the guys at Uncle Please Sit. Another really interesting conversation about the patriarchy. On Advertising is Dead, old friend Suchita Salwan showed up. Suchita is the founder of LBB. Great conversation she had with Varun. Definitely do check that out as well. Tanvi Lad, who is a nationally ranked badminton player, was on The Habit Code with Ashton Doctor. Great conversation. I would highly, highly recommend that. The Football Shitwall guys are back. They've been back for a few weeks, but definitely do check out their latest episode. Great conversation they had. On Aditi Surana's Absolutely Right, Manju Sara Rajan was the guest, and again, a great conversation was to be had over there. As always, great conversations all across the board. Check out some of the other stuff like Smile India and Know Your Kanun and All Things Policy. All of them had fresh episodes this week, but with that, I hope to see you again next week.
Hi, my name is Anupam Gupta. I'm B50 on Twitter. I am the host of Paisa Vaisa, the show that talks money. On my show, I speak to experts from every field of money and finance, from stock markets, equities, debt funds, credit cards, life insurance, every possible area of money and finance that you can think of. We even did an episode on cryptocurrency. I've got fantastic guests from mutual funds to personal finance experts everywhere. Robo-advisory, startups, just name it, we've got it. At Paisa Vaisa, we help you make smart decisions about money. You work hard for money. Now make your money work hard for you. New episodes out every Monday, and you can listen to my show on the IVM Podcast app or any other podcasting app that you have.